Bismillahirrahmanirrahim. Assalamu alaikum. We have this patient presented to us with the history of seizures and mental retardation. A CT brain was performed, and you can appreciate a lobulated mass at the level of frontal horn of the right lateral ventricle as well as in the frontal horn of the left lateral ventricle. This is one mass. This is the second mass. So it is post contrast. It is showing enhancement as well. We can also appreciate multiple calcifications along the subependymal locations. These are subependymal calcified tubers. So calcified tubers in the subependymal location, masses in the frontal horn of the lateral ventricle, which likely originate from the level of foramen of Munro. So putting things together, this is the case of tuberous sclerosis with associated SAGA. SAGA stands for subependymal giant cell astrocytoma. So it is whenever you are shown the case of tuberous sclerosis, please first look at the history of the mental retardation and seizures, associated skin findings in the face, and the imaging findings on the CT brain are subependymal hematomas or calcified tubers at cortical subcortical location as well as in the subependymal location. So whenever you diagnose the case of tuberous sclerosis, please look at the foramen of Munro. There can be a subtle small enhancing mass which could represent a SAGA. It is very important to look at images in the exam, and whenever you diagnose this case, also look for the associate findings in the lungs. Suggest HRCT to look for LAM, suggest echocardiogram to look for the rhabdomyoma, as well as suggest ultrasound abdomen to rule out the angiomyolipomas. These are the associations of the tuberous sclerosis. So it is an important case. These masses were very large. These are causing obstructive hydrocephalus, midline shift towards the left side. These are easy to diagnose, but in some exams you will be shown subtle pinpoint enhancing masses which are hard to detect, especially on films, and you can miss them. And even in the real life scenario, please look closely at the level of foramen of Munro and perform post contrast images to diagnose associated subependymal giant cell astrocytoma. Thank you very much.